Welcome back. It's almost 9:17 here on North Dakota Today. When you're a parent, kind of goes in stages like this. Do I take my child to the doctor? Can I treat myself with over-the-counter medications? It's the middle of the night. Can I wait till the morning?
Yep.
Do I need to go to the emergency room? Can I just take my child to the walk-in clinic? I don't know what to do.
Yeah, we're going to walk you through all this to help you sort it out this morning with the help of nurse practitioner Carrie Ravinius. Welcome to the show, Carrie.
Thank you.
And happy Nurse Practitioner Week to you.
Thank you very much.
In fact, you kind of like head up the whole group for the state, right?
Right. Yes,
Okay.
I'm the president.
What is this organization?
The North Dakota Nurse Practitioner Association, and
Okay.
we are a group for the state of North Dakota for any nurse practitioner who wants to join.
And you are based out of?
I am from Elgin.
Elgin.
Yes.
Okay.
Okay, now tell me the difference, before we get into the ER thing, just quickly, what's the difference? I mean, what is a nurse practitioner? What makes a nurse practitioner?
A nurse practitioner has advanced education. We have a master's degree, and now there's actually a doctorate degree available too for a nurse practitioner. And we see patients in clinics, in hospitals, and we take care of them. We do preventive treatments.
So what's the difference between what you do and just a doctor, a typical general practitioner doctor?
Right. Well, a doctor goes through medical school and a residency, and we go through a 2 to 3 year program after our bachelor's degree. And so we
it's
have
just
a master's
the amount
degree.
of schooling, basically.
Right, yes. We do collaborate with physicians and other specialists too, but
So you're playing a really important role here in North Dakota now too, because there's so often, the nurse practitioners who you're going to see unless it's a true emergency, right?
Right, yes, and nurse practitioners do work in the emergency room too. For instance, in Elgin, we have a rural hospital, critical access hospital, and nurse practitioners and physician assistants can take call for the emergency room, and there isn't a physician present, only
Okay.
by phone.
By phone, okay.
Right.
All right, well, that's good to know.
Well, let's tackle this topic, whether or not to go to the emergency room, because all we hear in the media are a lot of reports from emergency room officials that say, look, we're swamped because people are showing up here and we are obligated to give them some sort of basic treatment. So
Correct.
it's really important for parents, perhaps, anyone watching this morning, to know when it's appropriate to go to the ER, when not so much. So we've got a list of things to keep in mind if you think you need to go to the emergency room. So let's put that up and kind of walk through this, shall we?
Sure.
Okay,
yes.
first on the list, severe pain of any part of the body. Now, what do you mean by severe? If you've got a bone sticking out, that's severe.
Yes,
Okay.
definitely. You should be going to the emergency room. If you have severe pain that needs to be treated immediately, you should go to the emergency room, because if you go to a regular clinic or an urgent care clinic, you're not guaranteed that you're going to be treated for that pain right away. In the emergency room, they'll have a triage nurse or someone that can assess you, and if you need pain medication immediately or treatment for your pain in some manner, then they can take care of that.
Okay.
Well,
For you.
that seems like an obvious one, but what about the less obvious thing? Like, the baby's crying, it's 2 in the morning, he's got a fever. How do you know when that is something?
Maybe a hard time breathing
Yeah.
on the
Right.
list there, respiratory issues.
Yes, if there is difficulty breathing, then you need to go to the emergency room, because if it's a child or an adult, because that can signal something serious. In children during the winter especially, there's RSV and things like that, and it can get to the point where they can become very distressed and respiratory distress. So
And
you
then
need
one
an
more,
emergency
yeah,
room
one
for
more
that.
thing on our list for anyone watching. Of course, you have the typical, the heart problems.
Yes.
You feel the numbness on your left side. You got to go to the emergency room.
Yes,
then.
definitely, no question about it. Any chest pressure, chest pain, a twinge in the chest. So many people will ignore those
Yeah.
signs,
Right.
and that is just something that definitely should take you to the ER.
Okay.
When we come back, we're going to talk a little bit more about this issue and some of the specifics, so don't go away.